Hello, everyone. I'm Perlita Cabrera, and this is my smoking cessation project. So, my patient was a low income Hispanic male who was 47 years old. He smokes daily. He smokes about one fourth of a pack per day and smoking since he was 14. In his medical assessment, it indicated that there were no systemic conditions, no medications. Blood pressure was 130 over 80, but this could have been caused by his dental anxiety. For dental assessment and treatment, my patient was an AAP stage 2, grade B, and we did SRPs of the upper and lower left quadrants. He was a Westerly Calculus Code 4, medium, and he was a heavy bleeder. So, my patient stated that he smoked since he was a teenager because it was a common thing to do at his age where he grew up. He feels like he is a nervous person and smoking helps ease his nerves and stress from work. He is also aware that smoking can make him sick and may lead to death, but he says he feels fine. He was open to learning more and said he was willing to try to quit smoking. So, my patient is aware that smoking can cause cancer and lead to death, but not aware of other health effects. He is open to learning about replacing smoking with another way to cope with stress and anxiety, and he's a visual learner and he needs an affordable method. So, my plan to help him quit smoking was to have smoking cessation counseling at every appointment, educate him on the effects of his health from the smoking, educate using over the counter treatments, and educate on possible withdrawals from the nicotine and how to cope with them, and also motivate the patient to start making changes in their daily choices that will help them quit, such as exercise or be more active. So, for my implementation, I treated my patient for two SRPs, so I counseled him at those two appointments. We did not complete the right side of the SRPs due to the scheduling. He works Monday through Saturday. And then I provided printed educational information. I recommended over the counter aids. I printed personal incentive program and recommended exercise, recommended to drink more water. And my patient seemed very motivated to try all the suggestions. And we planned a follow up in 3 months. These are some of the aids that I recommended for him. So, drink water when the cravings kick in, have some educational information that I printed for him. I showed him the patient education book at the appointments that I did see him, and I printed smoking cessation information from that book. I also gave him withdrawal information and resources. For over the counter aids, I recommended the Nicorette chewing gum and Nicorette lozenges. And the personal incentive program was a program I created, which was a monthly chart where he can track the progress he's made, which means like reducing the number of cigarettes per day. And reaching the monthly goal will allow him to treat himself to whatever he wants. And also, exercise was suggested so that he can cope with his mental health and his cigarette cravings. This is a page out of my patient education book, which I printed out for him to kind of give him some positive reasons to want to quit smoking. Hopefully, it will serve as motivation. And where this arrow is pointing is something that I wanted to go over with him since he is aware that he could get sick, and but he's also very he cares about his job. He needs to be working Monday through Saturday. He feels that he cannot miss a day. So I wanted him to see that if he quits, that he has lower chances of getting cancer, heart attacks, heart diseases, strokes, and all those things. And he'll be less likely to get sick. And here's just additional reasons why he would want to quit. And I provided resources such as apps, phone numbers, and websites that he can go to. And this is the monthly incentive chart that I created. So it's a point system, and you can see there's a point values on the left side. Um, there is a 100 points total that he can get a prize. So this can be changed as his goal changes as well. And at the bottom, it shows you there's max weekly points, which is 47. The maximum monthly points are 188. It's kind of hard to see. And then I have here some common nicotine withdrawal symptoms that I provided for him, and it includes the nicotine cravings, anger, frustration, or irritability, difficulty concentrating, insomnia, restlessness, anxiety, depression. So, not every person will experience the same symptoms. So, I did provide a QR code that has the website that addresses each and every one of these. And then they also include information on how to deal with the withdrawals and get counseling and more printed information and referrals as needed. So, because this is a very personal experience, I thought it was helpful to just have this QR code accessible to him. And so for my evaluation, he did try drinking more water, but it was not successful. After a few weeks, he said he only likes to drink water when the weather is hot. He did not purchase any over-the-counter aids like gum or lozenges. He stated that it was out of his budget right now. He incorporated walks and public transportation to go to and from work a few times a week, and it's helped him feel better about himself. He says that he does feel that it's helped with the stress. And in conclusion, he was able to minimize the amount of daily cigarettes. He is down to 1 to 3 cigarettes a day, and he states that he will try again someday. Hopefully, with continuous counseling, he will reach 0 cigarettes a day. And these are my references. And thank you for listening.